All right, guys, welcome back to another episode of Smile Theory Podcast. I've got my friend, Dr. Justin Nafso, Ann Arbor Dental Associates. Welcome to the show, brother.
I appreciate you having me, man. Thank you.
Absolutely. So you and I met relatively recently, right? Was it 6 months, a year?
Yeah, about that.
Yeah.
Mhm.
You were doing some work at Art of Dental. I'm the content guy there, and you helped me out on some things. So
Mhm.
thank you.
Mhm.
And just getting to know you. I know that you're relatively fresh out of school, like, I think 3 years out of dental school.
Yep.
And in those 3 years, you got, I think, really well-rounded experience kind of within the dental group. What was that like? What did you gain kind of out of, like, every location? How did it shape you?
Yeah.
Because we're gonna get into Ann Arbor,
Mhm.
which is your new office, which congratulations.
Thank you. Thank you.
I think it's a huge deal, but let's build up to that.
Yeah. I this is my sixth practice I've been working on. So I started off in a corporate office my first year, and then I jumped into the company we are now are with now, Dental Ventures, and I've had the opportunity to work at 5 different locations in our own company.
That's sweet.
So it gave me a really good opportunity to get a good mentorship there. So uh, we have multiple doctors at each location. So for me, biggest thing coming out of school was getting mentored because you only learn so much in school.
Right.
When I got to Dental Ventures, it was just mentorship, mentorship, mentorship. So I had the ability to work under Dr. Jabiro, Dr. Kostakos, Dr. Jossam, Dr. Kareem, and then all the colleagues that work underneath them. So I was blessed to be able to have that opportunity to learn from them, see how they run their own companies, see how they work clinically, and it wasn't easy
Sure.
at all because like I said, you don't learn much in school. Everyone says you go down to school, you come out, you don't learn anything.
Yeah.
At the end of the day, it's really just the bare minimum. So the mentorship for me was put myself in a position where learn, be a sponge, take in everything I possibly can, so that way when I go off on my own like I am now,
Yeah.
I can be successful.
So was that by design, the multiple locations? Like, did you know right off the rip that relatively soon you wanted to do your own thing and they kind of moved you around, or is it just played out that way?
It it was I hadn't envisioned myself, but it kind of played out that way.
Okay.
There was no talks of it early on.
Yeah.
It kind of just happened. I went to an office where I was doing a little bit different clinical work, and then I jumped over to Art Dental where I was, you know, production, production, production.
Yeah.
Dr. Cream is an unbelievable mentor. She put me through a bunch of uh, root canals type like things where I wouldn't even think I would be doing now.
Yeah.
It wasn't promised to begin with, but as the time went on, it became more comfortable for myself because I wasn't really sure early on I wanted it right away either.
Right.
I knew for myself, you always, I didn't want to downgrade myself, but I knew I wasn't able to do it early on, you
Right.
know. So once I got to that point where I was learning the business aspect of it, getting better clinically, I knew then at that point it was in talks of, getting my own spot at that point.
Yeah. And I think the cool thing about Dental Ventures is, like you said, every office kind of has a different, like, production style and in terms of volume. So I don't think a lot of people have the opportunity in a short window to know what it looks like to get some of those procedures, because a high production office is you're gonna be exposed to a lot more of it and get the small office experience. So I think it teed you up, I think, pretty well for Ann Arbor.
Absolutely. Yeah.
Which, tell me about Ann Arbor.
A lot to tell about Ann Arbor. So,
Yeah.
my company's Ann Arbor Dental Associates. We just opened up. It's on the border of Ann Arbor and Ipsy.
Okay.
We opened up 3 weeks ago.
Congratulations.
Thank you. It's been a year-long journey. So, year-long of construction and all that good stuff. But
Yeah.
we are officially open. It's a lot right now. This is the first
Amazing.
time in my life where I've had to kind of take on the role of that business owner,
Yeah,
and it's different.
for sure.
Yeah. I'm not sitting there just working on the clinical aspect of it. I'm working on the business aspect of it, trying to, build a culture and a team where, going forward, it benefits me.
Absolutely.
Yeah.
Um, a lot of people, I think, out of dental school, don't really take the fast track and the risk, and they're probably not even thinking about, being their own owner dentist. So what gave you the confidence to bet on yourself so early?
I think it was because, like I said, the mentorship. Yeah, I came out of school. I thought I knew everything. I didn't. I Once I put myself through that mentorship and I learned a lot. I put myself in positions to feel uncomfortable.
Yep.
Then I felt like, okay, now it's time for me to own my own office. I don't think for me, um, I wanted it until recently.
Yeah.
I didn't think I would be able to handle it. It's a lot. It really is. No one knows how much it is until you truly get into it.
Right.
So yeah.
That's
Mm,
awesome. And so tell me what you're building in Ann Arbor. Like, what's your vision? You talked about culture.
mm,
How do you think you get set apart? It's a big office, right? How many ops are there?
20 ops.
20 ops.
Hmm.
Yeah.
Yep.
So it's a nice operation.
Yeah.
What do you see? What makes Ann Arbor Dental Associates stand out?
Uh, I mean, it's hard to say right now. As of now, it's just me by myself over there.
Yeah.
I potentially want to have 4 to 5 associates with me within the year and a half. But right now, I'm just trying to create my own brand for myself.
Yeah.
I want to be able to bring people in and make them feel comfortable enough. And our office is very, very different. It's
Yeah.
12-foot ceilings. It's a nice decor. It's a little bit different. So I want people coming to not feeling like it's a dental office.
Yeah.
I want them to feel comfortable. I want them to feel like they want to come back. And so for me right now, I'm the only doctor there. So going forward, I want to bring other doctors in, bring other hygienists in, build a culture to where they're comfortable and they're able to take on those patients as well, the same way I would want to take it on.
Right.
Because I like to do things my way, and I
Yeah.
want people to kind of see how I like to do it, and kind of then they can do it their way too.
And what does that mean for like patients? Let's say you achieve your vision exactly the way you want it.
Mm.
How do people leave? What do they feel as patients of your practice, or what
Yeah,
do you want them to feel?
I want them to. It's actually funny because we only been open 3 weeks, and I've had a crazy ton of referrals from patients. I want them to leave the office and say to themselves, you know what, I want to tell my family about this office.
Yeah.
I want to tell my friends about this office. Rarely people leave the dental office saying, "Wow, what a good experience." Because I mean, you're going there, you're in pain, you're feeling discomfort,
Right.
whatever the case may be. I want people leaving and saying, "Okay, I feel much better than when I came in."
Yeah.
So if I once I see someone said when I have a new patient that comes in and they tell me, "Hey, so and so referred me. My brother came here for an extraction, and he left very very happy." That's what I want to hear.
Perfect. So very organic growth. I mean, a referral is the most flattering compliment any provider
Yeah,
can get, right?
absolutely, absolutely.
Um, so that naturally leads itself very comfortably into something that I really wanted to talk about. And we'll obviously look at it from a dental perspective. This
Mm.
isn't unique to dentistry, but where would you say dental school flat out failed you in terms of expectations versus what you're taught and reality?
Yeah. There's a few things I'd say. So,
Okay.
uh, like everything in life, as a school, you can only really be good at a few things. Focus on a couple good things that you want to teach your students and all that good stuff. I think for me, it was the clinical aspect of it. In dental school, you only really do 8 root canals,
Yeah.
and then you're thrown out and to do multiple root canals each day on patients.
Yeah.
You only really do so many extractions, so many different types of procedures. Whereas when you get in the real world, you're probably you're probably doing those same amount within the first month as you were in the 4 years you're in dental school. So I would say for dental schools, it's almost impossible for them. But getting more of that clinical uh, aspect and giving your students more tough procedures so that they're more prepared when they get out in the world.
Yeah.
Like me, when I first came out, I only did 8 root canals, so I was hesitant to do a lot of root canals when I first came out.
Yeah.
I jumped at Art of Dental. I did, I don't know, 15 root canals on my first week there. And then it kind of set off that expectation for myself. And I want to do root canals now. I want to get as many patients in for that.
Yeah. So that brings up an interesting point because I think there's two factors. There's confidence, right? There's did I do enough of it? But would you say that they looked different? So like when you did root canals, like did you see things that you didn't see at all in dental school? Tell me about that.
Yeah, absolutely. In dental school, they kind of show you the bare minimum.
Yeah.
They don't really give you the opportunity to take on those tougher cases. It's
Right.
more so, the bare minimum cases, we'll refer out the rest of them. When you get into private practice, you have the obligation to refer or keep it in-house. We tend to keep them in-house.
Yeah.
We like to keep our patients in-house so they don't have to jump from place to place.
Right.
So we see a lot of tough cases, and because of the people that we have and all the doctors we have that have been working for so long, they teach us those type of cases.
Yeah.
For example, Dr. Daoud, Dr. Kareem, Dr. Jabiro, these type of doctors that I can put myself in a situation and take on a tough case, and they can be there to bail me out if needed.
Right.
So now I'm at that point now where I'm an owner, and I don't really, I wouldn't say need them to bail me out yet, but I'm more confident that I don't need someone to bail me out.
Yeah. And I wouldn't even necessarily call it like a bailout, but I think it gives you the opportunity to learn something without making a mistake. And a mistake on a complicated case, right? It could be all kinds of implications
Yeah.
for the patient. And usually, I mean, I'm sure all of your mentors learned these things the hard way over the years.
Yeah.
So, I think the mentorship model is really interesting and really strong because I feel that it does bridge that gap of what you're not picking up in school.
Mm-hmm.
Because I had that, like I remember when I was an engineer, I was at Lawrence Tech, and they were going through like this whole accreditation, and there was guys that were working 50, 60 years in the field, teaching me the best things I ever knew, and they were getting rid of them left and right because they didn't have PhDs.
Yeah.
And they just told you like it was. Like, that's what it looked like when I was working. I practiced for a few years, 11 years. That's what it looked like. And then you've got like, these PhDs, and it's like it's all theory and stuff, and that's fine and dandy. There's a good balance, but if I tell you that is not what I did in the field, that did not help me.
Mm-hmm.
And then you know what I mean?
Yeah,
So
absolutely.
it's almost it's not just a compliment. I think in some ways it's more powerful.
Yeah, it definitely is.
So I mean, I've heard the stories, right? Hundreds of thousands of dollars in debt. You're telling me that the most important things you learned after dental school. So, in your opinion, 2026, is dental school worth it?
I would say yes.
Okay.
A lot of people ask me that question, would you go back and do it all over again? And I say yes, but hesitant sometimes.
Okay.
Okay, because nowadays, you can make money in a lot of different ways.
Sure.
So you have to love it to do it.
Yeah.
I have a uncle who's a dentist. I don't know if you guys know him, Nafso. He works at Bloomfield Hills Dental.
Okay.
He when I first got into school, I discussed with him obviously the financial about it, and he looked at it this way: it's an investment in yourself.
Yeah.
You're going to be 400 or 500 in debt. It is what it is. Act like it's a house payment.
Right.
You're investing in yourself at that point. You could either go through 8 years of school, or you can, jump right into, being an entrepreneur. But at the end of the day, this dental school teaches you something different than anything else,
Yeah.
So yeah, it was worth it. You're not going to get that education anywhere else. It's worth it for me, but I feel like, should it be 400,000, 500,000? Probably not.
Sure.
But at the end of the day, if dentistry is something you want to do in your life, you got to take that route regardless.
Yeah, it's not like one of those things where I'm just going to start a business. And I think I know a little bit just from working with a lot of dentists, but I think your approach is the right approach in that you are a dentist, and even at some point, if let's say you stop seeing patients, right, and you go completely on the business side of it, you understand how to, this is going to sound weird, provide for your providers because you get it. You know what they're dealing with. You understand the game.
Yeah.
I think it's great, like really, really well-rounded experience. So 20-year-old, 22-year-old in front of you right now, they're smart, they're motivated, they want to go to dental school. Do you tell them just to go the traditional path? Do you wish there was a different path that could be done better?
Yeah, I think I would tell them to shadow. That'd be the number one thing. I would say, you see the lifestyle of dentists on social media. You see they don't work a lot of hours. Maybe they're taking a lot of vacations. They have a nice car, this and that. But until you actually see the day-to-day of what a dentist does, you're not going to understand whether or not you're not going to know whether or not you're going to do it or not.
Right.
I have a lot of, younger kids that come ask to shadow me, and they come and they watch me throughout a whole day, and it's it's easier said than done.
Sure.
I don't have a lot of opportunity to sit down. I'm up and moving from patient to patient,
Yeah.
and I'm working a lot of hours, especially early on.
Right.
So if I were to tell a 22-year-old that's coming to me, I'd say, "Hey, go watch different dentists, see how they work their offices, how their lifestyles are. Look at their paychecks, look at how much they're making
Right.
in terms of what they're producing and how much they're taking home. Is that something that you want to sacrifice, 4 to 8 years of your life to do,
Right.
or and it's not an easy decision to make because, like I said, you're sacrificing basically your 20s to become a dentist.
Right.
Not a lot of people want to do that. And I'm the only dentist of my immediate friends. And so when I was in dental school, they were all taking vacations, they were all
Right.
making money, they were all doing a lot of things that I couldn't do.
Yeah.
So I would say for sure, just make sure it's the right decision for you before you do anything else.
Yeah. And I think like you said, it goes back to being an investment in yourself,
Mhm.
right? There's a lot of people that will say, I don't want to go because of the time for many different reasons. I want to get married. I want to start a family. I want to do this, that, and the other. And they go a different route, and that's fine. But then there's a lot of people where it's just like, okay, I don't want to do it because of the time commitment. And
Mhm.
sometimes they don't do anything. That time's going to go by anyway.
Yep.
You know what I mean?
Mhm.
But I like what you said about the shadowing because I experienced it firsthand. I want to say this, by the way, like I was miserable as an engineer.
Mhm.
And it's not because I didn't like engineering, I was good at it. But it's because when you go into it, you're thinking, okay, I'm going to do this. I'm going to design circuits. I'm going to write code. But there's so much overhead of processes, meetings, notes, having other people do it. That it's like that's not all you're going to do. So I think that's another thing they can see is like the balance. Like, are you in people's mouths all day?
Yeah.
No. You're taking notes, you're doing whatever, you're having your morning huddles and
Yep.
all that stuff.
Yeah.
And they need to see what that looks like and the ratio of how much you're doing. You know what I
Yeah.
mean?
I mean, for myself, I've been a business owner for now 3 weeks, and I didn't realize how much went into it until 3 weeks ago.
Right.
I was an associate for 2.5 years, and yeah, I was 30 always a morning huddle. We were staying late. We were seeing patients, but am I seeing? I'm looking at every order. I'm making sure all the assistants are doing what they need to do. Am I hiring the right people? Do people need to be fired? What's going on the back end? Are
Right.
people happy? Is my money coming in? Uh, are patients happy? What type of reviews are we getting? There's just so much going on that
Right.
you don't realize until you become an owner.
Right.
And I would say most people who become a dentist at some point want to be an owner,
Yeah.
you know?
But they need to be able to stomach the business side of it.
Yeah.
It's different.
Mhm.
It's like you could be the best dentist in the world
Mhm.
and may or may not be a good, owner slash manager slash,
Mhm.
uh, I don't know what to say, like, people manager,
Leader.
right? Yeah,
Yeah,
leader,
yeah,
leader. Um, so yeah, like I definitely get that. And yeah, so you've been an owner for 3 weeks now.
Mhm.
Tell me about something that's humbled you in those 3 weeks.
Uh, it's probably a couple things. Uh, I would say it's actually funny. I didn't know, obviously dental instruments, supplies are all very expensive.
Yeah.
You know, in terms of humbling myself, like I didn't realize how much, we have to actually monitor all that. So I got our big order in of 60,000 of all the dental supplies that we got.
Yeah.
And I'm sitting there checking off every little thing that's coming in. And now it's 3 weeks in and there's things missing, things there, and I'm being so teety tighty with every single thing that we're missing or not ordering this because we have just enough, because there's just so much money going into it.
Yeah.
I don't you know, it's funny because I laugh at Dr. Kareem all the time because like I'll ask her to order something or do this, and she's always a little bit hesitant. I'm like, why? Who cares? But now I kind of get it.
Now you care.
I care a lot. How much we're bringing in and what we're sending out.
Yeah.
Um, in terms of like being an owner, I'd say just managing the staff. That's probably the biggest thing that's humbling myself. I played a college sport. I was captain of my college team for 4 years. So I was leading a lot of players throughout the years, and
Sure.
it was difficult at times. It's completely different on a dental side.
Yeah.
Leading them and making sure that everyone's happy, making sure that everyone's getting what they need,
Right.
and so that they can do their job, so that I can do my job.
Yeah. But I would argue too that that mindset is probably very helpful, because you understand it. It takes a tribe, right? It takes a
Yeah.
team. It's not one person, and a lot of people don't do that,
Mhm.
right? A lot of people just like it's like me, 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 me. So,
Mhm.
um, knowing what you know now, so like is it you've got into comfortable practices, you got into high production practices, and now you're a business owner, and you've got I think you're in a particularly tough position right now because you're building this practice up, right? So not only are you the 10,000-foot view,
Mhm.
right? You're also down on ground floor, make sure your patients are happy, make sure your staff is happy,
Yep.
right? Does it excite you? Does it scare you? Both?
It's like a nervousment excitement.
Yeah.
Excitement. It's I want to do well, but I want to obviously see a profit on it, but I also want to make sure that my patients are happy.
Yeah.
Uh, I go in every day and I try to take it day by day. It's sometimes hard to do that,
Yeah.
but I try to just manage my days and set my expectations each day so that I kind of know what I'm getting myself into.
Yeah.
Um, it's frustrating sometimes though.
Sure. Yeah.
It's frustrating, I would say the least. I spend, we have longer hours, but I'm there 30 minutes early and I sometimes leave 2 hours late
Yeah.
just because I'm making sure that every little thing is good at this point.
Yeah. You're the glue that,
Yeah.
you have to compensate for everything that's not going perfect. So I
Mhm.
mean, I get it.
Yeah.
Um, 3 years later, what do you tell your graduation day self about the future?
Uh, uh, don't worry about the money. Worry about learning. I tell every new grad that I have a couple family members that have just graduated dental school, and they talk to me about the offers they've gotten and this, and they never tell me about the office, what
Yeah.
they're going to be learning, who they're under, what type of patients are they going to see. Eh, I would tell myself just learn. Put yourself in a position to be a sponge. Never settle for the early payment because it's not going to last in the long run.
Yeah.
I had that. I kind of made that mistake early on. I went to a corporate office and I was like, okay, how much am I going to make daily? How much am I going to make hourly? And it kind of screwed me over in the end because I didn't get the mentorship I needed at that first year.
Yeah.
Uh, I would tell people make sure that you put yourself in a position to be mentored, to learn, to not just the clinical side but the business side,
Yeah.
and so that way, in 2, 3, 4, 5 years, you're able to go off on your own and do your own thing.
Yeah.
Because not everybody wants to be an associate the rest of their life.
Right.
I'm assuming most people don't, you know?
Yeah.
Especially for me, I knew when I got out of school, I wanted to own my practice at some point.
Yeah.
So I think other than the first year, I think I've done a good job of, trying to learn and grow and see other types of things so that way I can do it for myself as
Yeah.
well.
And I think even that first year, like, I mean, it taught you what you didn't want, right?
Yeah.
So it's a valuable learning experience. You mentioned, not everybody wants to stay an associate.
Mhm.
Let's flip that perspective. Let's say somebody does. They like the comfort, they like the convenience. Is dentistry still worth it for them? Can they still thrive in the industry, in your opinion, if they don't want to go the route of business?
Yeah, absolutely. I know of, few veteran dentists that have been working for 20, 30 years that uh, they love what they do. They make good money. They've established a certain clientele in that practice, and they don't have the headache of the business aspect of it.
Right.
You just have to do it right. You can't, if you're sitting in a corporate office for 20 years and you're not really getting the benefit financially, and you're seeing that amount of patients, maybe or maybe not worth it.
Right.
But if you're sitting in a private office where you're seeing a clientele come in and you have a good contract where you're making a good amount of collections, good percentage of collections, it can definitely be worth it. You Not everybody has the ability to own a practice. Not everybody has the leadership skills, the mindset for it, the time for it.
Right.
A lot of people like to see their patients and then go home, not worry about the orders, the insurances, hiring, firing, all
Right.
that good stuff.
Yeah.
So if you don't want that type of headache, yeah, you're fine and to do that and make good money. Uh, but you just have to make sure that you're in a certain situation that benefits you.
Yeah. Right. Like you understand the situation, and like, to further support that, not every single person that makes an office run can be an owner. You know what I'm saying? Like, everybody has their role. They're a critical part So you have the unique vantage point right now of building an office from the ground up.
Mhm.
Tell me about that experience. What are some of the decisions you made? I'm sure from down to the way the place looked to the way it's gonna flow to,
Yeah.
how many people are working on day one, what do you
Mhm.
need for support? What does that look like?
Yeah, I mean, I had the pleasure and the benefit of having a team with me, Dental Ventures, that
Yeah,
helped me throughout this whole process and guided me. It's obviously the first time I'm doing this, so if you told me to start by myself, I would have nowhere to start.
right.
So they put me in a position, to help me with all of this. We started a year ago on the construction. Um, they came to me with the location. I liked it. Uh, I went there. I saw it. We had a vision of how we wanted to build it out.
Yeah,
This vision changed like 10 different times,
sure.
okay?
Yeah.
And,
I did your logo, by the way.
yeah,
Yeah,
yeah, you did
that's
my
my
logo, yes.
logo. And you made it easy, so thank you.
Thank you. That was my biggest thing for me is I wanted to make it simple and easy and
Yeah,
nice. I didn't wanna have anything extravagant. If you have anybody ever does come to my office, you will see, it is very, very nice, but there's not like a lot of, I would say little, you know, details in there just yet.
yeah,
I wanted to build it out first, so that way when I have everything kind of the gist, then I'll put the little details in. But it was a journey,
sure.
a year long process where we switched up on the color of the chairs, the color of the wall, the
Yeah,
the flooring. What were we gonna do with that? This was too expensive. This was a little bit cheaper. These two things are not gonna match that very well. And then obviously Vince, my construction guy,
yeah,
I kind of put him through hell, I would say the least. Uh, but he still loves me, I guess. So that was more of the construction side, and then leading up to an opening day, the biggest thing for me was who my staff was going to be.
yeah,
We had I can't even tell you the amount of working interviews that came in and out of Art of Dental actually, uh, and you know we had 5 assistants on the first day
wow,
and 3 front desks, office manager, and a hygienist. So that hiring process was a lot,
yeah,
a lot, because you want to hire people you know, that are gonna portray your type of practice that you want,
yes,
not just people. Okay, someone can come in, they're good at what they do, just bring them in. No, I want people that are actually gonna, you know, treat patients the way I would treat them. I want people who are gonna welcome patients into the office the way I am. I want people who are early on time, working and and then able to kind of take on a role that I necessarily don't have to force them into.
yeah,
You can, I can bring assistants in and then they can be lazy and I can force them to work,
right,
but I want someone who wants to work, who wants to come in and help and be part of the team and make things flow a little bit easier.
yeah. I think that gives you the confidence that things are getting done right, takes away a layer of anxiety
Yeah.
from you. A lot of it's like, does this person feel well the culture and the
Mhm.
values and all that,
Yeah.
you designed all that.
Mhm.
So, you know what you're looking for. I look forward to seeing you grow to what you're gonna achieve. I'm very happy for you. And we're gonna probably continue to work together in some capacity. So I appreciate you coming on the show, man.
I
Best
appreciate
of
you
luck,
having me, man. Thank you.
brother.
Appreciate you.